Okay, assalamu alaikum everyone. My name is Yousef Alghamdi. I'm a third year medical student. Today we'll be reviewing the POD microbiology. So before we start, wait, my laptop's not charging. Sorry, give me 1 second. Okay, almost died. Okay, so before we start, this session is going to be, there's going to be a lot of explanation rather than just questions. Because there's no point in explaining just 2 or 3 things about a microorganism, especially like parasites and helminths, because there's a lot going on around them. For bacteria, it's just going to be questions because they're very straightforward. Ironically, I'm not going to be explaining viruses, so these are viruses. I don't know why I put them, but I will be explaining everything else, inshallah. Does anyone know what this microorganism is? Can anyone tell me what this is? It's a helminth, yeah, it's a worm. I'll give you a hint. They do a Scotch tape test. Yes, vermicularis. It's Enterobius vermicularis. Yes. Okay, what about this one? They do a scrape biopsy. Onchocerca volvulus, yeah. Okay. Okay, good. Inshallah, this will be session will be very nice. Okay, let's proceed. Bismillah. Okay, question 1. You're in the clinical laboratory looking at a gram stain. When the laboratory technician comes up to you and says, I think your patient has staph epi, or Staphylococcus epidermidis, bacteremia. Which of the following sets of results did the tech find when the organism recovered from the blood culture? So just, if you remember what staph is, or staph epidermidis. Is it gram-positive cocci in chains, catalase positive, coagulase positive? Is it also in chains catalase negative? Okay, yeah. So it's gram-positive cocci in clusters, right? And it's catalase positive and coagulase negative. Okay, so if it was coagulase positive, it would be Staph aureus, right? So yeah. Okay. Super antigen production by Staph aureus is involved in the pathogenesis of which of the following diseases? I remember this came in our final, so yeah. Toxic shock syndrome. Okay, good. Khas, you guys, okay, inshallah. I think you guys are good with bacteria since you did the midterm on it, right? Inshallah. Okay. A severely neutropenic patient presents with pneumonia. Bronchial alveolar fluid shows dichotomously branching with acute angles, septate hyphae. What is the most likely causative agent? Okay, you say A. Why is it A? What are the give-offs in this question? Okay, okay, sure. But let's say they didn't describe the microorganism to you. They just told you someone came with pneumonia, it was a fungal infection, and what was the most likely agent. They only gave you the clinical aspect, symptoms, that's labs, that's it. And they didn't put candida in the options. Immunocompromised, yes. So he's neutropenic, right? That means his white blood cells or neutrophils are low. So that means he's immunocompromised. So that means he's susceptible to aspergillosis and candidiasis, right? Okay, good. Uh, okay, so Candida albicans. Um, so usually we take a sputum sample, aspirates with pulmonary disease, tissue biopsies. They are not dimorphic. They have septate hyphae that form dichotomous branches, okay? I said Candida albicans, I mean Aspergillus, sorry. Um, Fumigatus, aspergillosis, not candidiasis. I think I said candida. Yeah, so you see like asparagus, it's candida. Okay, it looks like asparagus. Had I said candida again. I mean aspergillus. Okay, the name is similar, aspergillus, and what is it called? I just say asparagus. All right. Uh, so that's it for aspergillosis. Okay, which of the following antibiotics is the most appropriate to treat a severe necrotizing skin infection caused by MRSA? Okay, yeah, vancomycin, right? Vancomycin is the most high yield drug in the universe. You're going to be asked about it in every single block from here on out. MRSA is very, very common, and vancomycin is a very widely used antibiotic. What if this was Versa, not MRSA? What drug would we use? Linezolide, yes, linezolide. It's not in the options. Yeah, linezolide. Okay, good, good. Okay, which of the following laboratory tests is the most appropriate to distinguish between streptogens from other beta hemolytic streptococci? So what's the test we do for group B strep? Okay, I want more replies. Someone said D. Okay, yeah, it's D, the bacillus disc test, right? What about group A? What do we do? What do we use if this question was asking about group B? Yes, then we'd use the optogen disc test, right? What if it was positive optogen disc test? What is group A strep? Pneumo. Yes, okay. Okay, good. Strep pneumo, not pneumonia. No, wait, not pneumonia. Pneumonia is the disease. Strep pneumo is a microorganism, okay, that doesn't necessarily cause pneumonia, okay? It can also cause otitis media, stuff like that, okay? Don't say pneumonia when you're referring to strep pneumo, okay? But that's okay, and it's a common mistake. Okay, infections by which of the following bacteria are typically treated with penicillins, such as amoxicillin, because they exhibit neither low-level resistance nor high-level resistance, and synergy with an aminoglycoside is not required in order for penicillins to be effective. So basically, which of the following do we use penicillins? This is one of those questions that you just have to know. No, not Staph aureus, and not strep pneumo. Yeah, strep pyogenes, okay? So it's because they exhibit uh, basically no resistance, and and synergy with an aminoglycoside is not required. So you don't need multiple antibiotics, okay? Okay, which of the following is a large gram-positive rod that causes necrosis of tissue by producing an exotoxin that degrades lecithin, resulting in the lysis of cell membranes? Guys, be confident. Don't write C question mark. If the answer is wrong, it's okay. ترى عادي. This is the review session. If you make a mistake, you learn. Yes, thank you for moving question mark. Yes, it is Clostridium perfringens. Yeah. Okay, what can Clostridium perfringens cause? What diseases can it cause? Yes, gas gangrene. Okay, great. Okay, So this picture is part of the question. It's not like a design, okay? A kitten is taken to the veterinarian because of crusty lesions on its head and ear. The vet, recognizing the infectious nature of the lesion, suggests culture of the lesion and treatment of the kitten to prevent possible transmission of the organism to family members. A 3-week culture of the organism is shown in the photograph. What is the etiologic agent? So this one's easy to remember, right? Because it affects canines from the name canis. Even though canines usually refer to dogs, it refers to animals with the canines. Yeah, so this is Microsporum canis. I didn't put the answer is D. I need to add the answer slide, I think. Okay, so this is Microsporum canis. It has a white cottony surface and a deep yellow on the reverse. It has large multicellular spindle-shaped microconidia with echinulate walls. So if you see this, it's Microsporum canis. There's not much to explain, but I thought it's very important for you guys to see the what is it called, the agar and the culture and the microscopy. Okay. A patient develops diarrhea 5 days after starting antibiotic treatment for a serious staphylococcal infection. What's the most likely causative agent? Is this now? Could be, okay. It is, yeah, it's Clostridium difficile, yeah. Because it causes pseudomembranous colitis, right? Yeah, like I said, which causes diarrhea most commonly starting 3 to 4 days after antibiotic administration. MashaAllah, the clean. Okay, good. The reagent used to distinguish staphylococci from streptococci. Easy question. Hmm. Someone said A, someone said D. Yeah, it's A. Yeah, it's A. Okay. Hydrogen peroxide. So staph are aerobic, while streptococci are aerotolerant anaerobe. Streptococci ferment even in the presence of full oxygen, and like today, standard cook test is test mixing staphylococci with hydrogen peroxide. Yeah, so if it generates oxygen bubbles, then it's gram-positive staphylococci rather than streptococci. Okay. 7-year-old female child is taken to an urgent care facility because of fever and periodic incontinence. The physician suspects a UTI. What is the most likely etiology of this child's infection? So what's the most common microorganism that causes a urinary tract infection? Saprophyticus? No. Guess again. Good thinking. We'll guess again. It's E. coli, right? Escherichia coli is the most common UTI. So most of these, they cause UTI, but E. coli is just the most common. Okay? An 85-year-old male, we're going to be done with bacteria soon. And a lot of this presentation is parasites and helminths, okay? 85-year-old male nursing home patient with a history of alcoholism suddenly develops flu-like illness. He complained of chills and fever and had frequent cough spells, productive thick, bloody sputum. The attending physician diagnosed bronchopneumonia and prescribed antibiotics. But regrettably, the patient died within a week. What is the most likely cause of the patient's pneumonia? Hmm. There is a very, very big give off in this question that tells you 100% what this microorganism is. There's one thing they could have said too, that it looks like currant jelly, red currant jelly. They usually say that for this microorganism. It is not strep pneumonia. Yes, Klebsiella pneumonia. So when you see an alcoholic, you immediately think Klebsiella. Okay, and then you read the question, obviously, make sure it's not Klebsiella. You did, I checked, it's in your slides, Klebsiella. I didn't put any question that's not in your slides. They even saw the red currant jelly thing. The red currant jelly, they tell us in CVP third year anyway, but yeah, it's good to know. Bloody sputum, thick. Oh, okay. Good. Okay, good that you study sketchy. But yes, I'm sure this is in your slides. I saw Klebsiella. It's at least in the first slide where he's telling you the microorganisms, the bacteria. Dr. Bota slides. Okay. Hemorrhagic colitis, hemolytic uremic syndrome, and thrombotic thrombocytopenic purpura are clinical manifestations of which bacterial species? You see this in the options, you immediately pick it. It's always right. Yes, the E. coli is 0157H7 because of hemolytic uremic syndrome. Yes, 100%. Um, Good to know that it also causes hemorrhagic colitis. Okay. Okay. Blood and urine cultures are taken for a 73-year-old man hospitalized with suspected E. coli urosepsis. Which culture medium would allow selective growth of gram-negative enterics while suppressing the growth of gram-positive bacteria? Hemophilus and Neisseria. So you guys should know this. Yeah, it's a McConkey. McConkey agar. No one else is answering. Okay. Self-explanatory. Okay. A 14-month-old boy is brought in by his parents with a fever, fussiness and lethargy, and apparent headache. So what do you think? Meningitis, right? On examination, the neck is stiff. Again, meningitis. His parents have not given him his routine childhood vaccines. Very short gram-negative rods are seen in the CSF. They did the CSF, so again, I think meningitis. So antibiotics are immediately started. The organism grows on chocolate agar, but not blood agar. No one else in the family is ill. What is the most likely causative organism? You said D. Why do you say D? 220343. Why do you say D? Okay, so that doesn't mean it has to be Neisseria meningitis, right? Where is Neisseria usually contracted from? So the usual scenario they tell you about Neisseria is if it's in a large group of people. مثلا, for example, the kid went to a birthday party or something and then they came home sick, or they went to Hajj, Umrah, and Neisseria is diplococci, it's not rods. Yes, um, you're right. Anyway, this is Haemophilus influenza type B, and something. Let me just remember. Um, yes, okay. So Haemophilus is Coccobacilli. Okay, rods means Coccobacilli. It's gram-negative Coccobacilli. What else do you know is gram-negative Coccobacilli? I'm not sure about Klebsiella actually. It might be. I'm not sure. But the one I had in mind was brucellosis. Okay. So Brucella, the one that's from goats and sheep, Brucella melitinosus, and the other species, they're gram-negative Coccobacilli. Yes, diphtheria. That's the one I was thinking of. Pertussis. Okay. Um, a 3-year-old female child presented with a febrile headache, vomiting, and swollen right knee was exquisitely painful upon motion. Physical examination revealed a petechial rash on the skin. Gram stains of the synovial fluid revealed presence of gram-negative diplococci. And culture suggested a strict aerobe that fermented glucose and maltose. Capsule antigens were also detected by serology. Which of the following is the most likely causative agent of the disease? We just said which one's diplococci, right? Yeah, Neisseria. Yes, Neisseria meningitis. I didn't tell you where she was before, but they told you no, it's a gram-negative diplococci. Okay, fungus. This is also part of the question. A high school wrestler develops a superficial lesion as shown in the photograph. Which description or term is frequently used to describe the fungal group responsible for this infection? Yeah, so it's derma, skin, dermatophyte, right? Um, okay, so this is a two-parter, and then I'll get into the explanation of dermatophytes. Two of the patients in the previous question, teammates, also have similar lesions. If cultures are taken to identify the causative agent, which laboratory media would be used? Yes, several dextrose agar. So Dr. Muhammad explained this well. This is very important. Okay, so this is cutaneous mycosis, cutaneous as in skin. Um, it grows on for 2 weeks on 25 degrees Celsius. Several dextrose agar can infect hair, skin, nails. It appears as cylindric, smooth-walled macroconidia with characteristic macroconidia abundant grape-like clusters of spherical microconidia on terminal branches. So it looks like a grape tree. This is a mouthful to read. Trichophyton tonsurus. This is important. A good way I used to remember this is I thought of phyton as in photo, and this kind of looks like it's makeup. On one side it's white, on the other side it's red. So maybe that's something you can use. And surah in Arabic means picture too. So and dextrose agar, which contains glucose and modified peptones. Okay, a 25-year-old woman presents with septic arthritis of the knee. Um, the fluid aspirate grows a gram-negative diplococcus on chocolate agar after 48 hours of incubation. The isolate is oxidase positive and oxidizes glucose but not maltose, lactose, or sucrose. You suspect infection with? Yeah. Okay. So you think Neisseria gonorrhea, right? Because she's a 25-year-old woman, she's probably sexually active. This can be gonococcal septic arthritis, right? Okay. Answer is B. Okay, a 10-month-old male child presents with episodes of repetitive coughing with intermittent large gasps of air as well as some vomiting. Parents indicate that the child has been suffering from this condition for about 1 week. Incidentally, the previous week he was reported to have a cold-like illness with a fever and sneezing. A white blood cell count shows 65% lymphocytes, 30% neutrophils, and oxidase positive gram-negative Coccobacillus grown from a nasopharyngeal swab plated on Regan-Low charcoal agar. Which of the following organisms most likely responsible for this disease? So uh, we talked about this, right? We said it was whooping cough, pertussis. What's the microorganism that causes whooping cough? No, no, not the microorganism, pertussis. Wait, actually, my bad. Yeah, you're right. It's Bordetella. That was diphtheria for some reason. Yeah, it's Bordetella pertussis. Okay, my bad. This is a long question. Oh, okay. So you can read this, but then you can come here. Very small colonies were seen on sheep blood agar plate. The organism was a tiny gram-negative Coccobacillus that was catalase positive and oxidase positive. It showed urease activity after 2 hours of incubation on urea-containing medium. This child has an infection with what? And I told you just a few minutes ago about the Coccobacillus again. So what is it? No, I told you sheep blood agar. I told you there are three things you need to know, right? Pertussis, Haemophilus influenza, and one more. The Cocobacillus. Yes, brucellosis, right? So when you hear sheep, goats, stuff like that, you think of brucellosis. Okay? Okay, that's good. 1 week post-delivery, an infant boy becomes extremely irritable and continuously rubs his right eye, which contains a mucopurulent exudate. An examination of the eye shows papilla on the conjunctiva. No bacteria are seen in the exudate. The most likely causative infectious agent is, yeah, trachomatis, right? Because it causes ocular lesions. Chlamydia trachomatis. Chlamydia is one of the most important sexually transmitted bacterial infections. This is a 1 week post-delivery, so that means it could have contracted it from the mother, right? Um, genitourinary tract and the eye, non-gonococcal urethritis and ocular infections, right? Not lesions, I said lesions infection. Okay. A 27-year-old woman presented with a 2 week history of low-grade fever, chills, myalgia, headache, and non-productive cough. She was treated with an antibiotic that inhibits cell wall synthesis but did not improve because the causative agent lacks a cell wall. Which organism is she infected with? Yeah, Mycoplasma pneumoniae, right? What other organisms lack cell walls?
Wow.
Ash? Khalid? Saying something? Well, I guess that was by accident, maybe. Yeah,
Accident.
okay. So yeah, Mycobacterium tuberculosis, right? It's not necessarily that it lacks a cell wall, it's a lipid-rich one, right? So it's not usual antibiotics won't work on TB. We need the ripe antibiotics, rifampicin, isoniazid, pyrozinamide, and ethambutol, right? Anyway, your patient. Okay, plus I don't need to read the question, I guess. Yeah, it's H. pylori. Yeah. GI clinic describes sour stomach for several months. Antacids relieve the symptoms. So this guy probably has like stomach ulcers, right? You discussed the case with the resident. Urea breath test. You think Helicobacter pylori, right? Okay. So when you see this picture, what do you think? Without reading the question. Candidiasis, right? But let's read the question just so, in case they don't give you a picture. Treated for squamous cell carcinoma of the lungs, develops pneumonia, sputum sample cultured on routine lab media, grows cream-colored colonies within 24 hours. So candidiasis looks similar to Staph aureus, well, in my opinion. It's not like a fact. I think it looks like Staph aureus, but it looks like dots on the agar. Cellular growth in rabbit plasma shown in the photograph confirms identification of Candida albicans. So this is candidiasis. Okay. So this is Candida. You'll see pseudohyphae and just this budding yeast cells, right? Candida albicans is dimorphic in addition to yeast, and pseudohyphae can also produce true hyphae, but they call them pseudohyphae because, right? Okay. Okay. You see this picture. What do you think? A targetoid lesion. Yes, you think Lyme disease, right? So what microorganism causes Lyme disease? Ticks. You're right.
Borrelia.
Yes, Borrelia burgdorferi, right? It's caused by ticks. Does anyone know the name of the tick? It has a funny name, a weird name. No, not Rickettsia. Yes, it's ixodes. Borrelia is the name of the microorganism, the bacteria, but it's by what is it called? The ixodes, ixodistic, however you pronounce it. IXODES. Okay, AIDS, immunocompromised, 22-year-old man with AIDS complains of persistent cough, night sweats, low-grade fever, and general malaise. A chest X-ray reveals an area of consolidation in the periphery of the left upper lobe, consolidation in the lung, as well as hyalurolymphadenopathy. Sputum culture shows acid-fast bacilli. Because this gives it to you, right? So this is tuberculosis. There are so many give-ups in this question. Immunocompromised, 1. Night sweats, 2. Consolidation in the lung, and hyalurolymphadenopathy. And they just told you it's acid-fast bacilli. So acid-fast bacilli is TB. So what stain would we use for acid-fast bacilli? ZN. ZN Nelson, yeah. Okay. Okay, finally, parasites, my favorite. Okay, a missionary returns home from South America because of health problems. Principally, the patient is suffering from weeks of acute colitis. The diarrheic stool sample submitted for analysis positive for occult, blood. So when you see blood in the diarrhea, you should immediately know the answer in POD, okay? Trophozoites with ingested erythrocytes shown in the image, the unconucleated cysts shown in the second image. Based on the clinical findings, is the most likely diagnosis. Yeah, amoebiasis. So what's the name of the organism? The full name of the Entamoeba histolytica. Yes, that's amoebiasis, right? Okay, Entamoeba histolytica. This is its infective stage, the mature cyst, and the diagnostic is both the cyst and the trophozoite, right? It has no animal reservoir, and it's ano-oral or fecal-oral route. Obviously, since it's ano-oral, it can be among male homosexuals. Entamoeba histolytica, this is the trophozoite, this is the cyst. The trophozoite has like these red cells, right? It looks like like blood, right? And they would usually come with what is bloody diarrhea called? What's another name for bloody diarrhea? Dysentery. Yeah. Okay. Good. Oh yes, this is important. So the cyst has 4 nuclei, and it's important diagnostically, because I remember in I think in our OSPE, it literally just gave you a random cell with 4 nuclei, and you were supposed to know it's Entamoeba histolytica. Okay. I'm not sure if it was in the OSPE or MCQs, whatever. Yeah, POD is the same. And the trophozoite has a single nucleus with an even lining of peripheral chromatin. So it's like here, you see it? Okay. It also causes a flask-shaped ulcer. This is very, very important. This exact picture came in our exam. And again, I'm not sure which part. SQ, MCQ, OSP, it's all the same. Okay, so flask-shaped ulcer, Entamoeba histolytica. Okay. Okay. So someone mentioned this one before. Yeah, a 32-year-old female. No, never mind. They mentioned something else. Greenhouse worker seeks medical care for an ulcerative nodule on her right distal forearm. Has persisted over a month. The lesion began reddish bump above the right hand. Where the patient had received multiple scratches. Right hand isn't specific. It's about the reddish bump, just so no one gets confused. From moving on, thorn-covered bayberry plants. So, yeah, this is E, but this has another name. What is this called? This disease what is it called? Gardeners, right? Yes, you're right. So when you read this about here, you should already know, but you can read, he was empirically given antibiotics for staph and treated and no improvement. As a visit, there's no she's afebrile and no significant pain. Cultures of the lesion yield dimorphic fungi. So then you'll know for sure it's Sporothrix schenki. So it's subcutaneous mycosis, Sporothrix schenki, traumatic inoculation with contaminated material, also known as Rose Gardner's disease, right? sporotrichosis, which is a chronic granulomatous infection. Okay. Okay, you look at this picture. Do you know what this is? What is this? Without reading the question, even. Imagine this is an OSFI question. It's not really. I don't know if it's a mosquito. It's called a fly though. Because and you know microbiology, they can say fly and then they say, oh, this fly is a mosquito. Yeah, this is a sandfly, so it causes leishmania, right? Leishmaniasis. So there are how many types of leishmania do you guys know? You guys know three? Okay, what are the three? I thought you guys knew four.
cutaneous or
أيوه.
mucocutaneous
صحيح.
and visceral.
في visceral and visceral. Yeah.
Cutaneous and mucocutaneous.
Yes. حلو. The mucocutaneous caused by it's the same as their flag. Mucus is green, their flag is green. Leishmania Braziliana, right? Cutaneous is by Mexicana and Tropicana. Yes, and the visceral is by Leishmania donovani. Okay, good. I don't even need to explain this, right? But I'll tell you the infective stage, if I can read it. Injects promastigotes. I think we're taking this right now too, in MSI. So promastigotes is the infective and diagnostic is the also promastigotes and amastigotes. Amastigotes are diagnostic and promastigotes are the infective stage. So they're the ones who cause the infection, and then the amastigotes are the ones who are diagnostic, okay? So this is by when a mosquito comes in, gives the blood meal, and then it takes it back, I think, as amastigotes as well. So yeah, we said Donovani, Tropicana, Mexicana, Brasiliana, right? Or Braziliensis. Donovani, we said visceral, and then Tropicana Mexicana is cutaneous, although in third year, Botta will tell you that Mexicana is mucocutaneous, but for POD, just Tropicana and Mexicana are cutaneous, Brasiliana is mucocutaneous. I remember this because the Brazilian flag is green and mucus is green. I should have put the Brazilian flag here in case someone doesn't know how it looks. Anyway, I look at this picture and I immediately know the answer. But we'll read it, right? A child who lives in a rural community in Appalachia and who has been ill for 10 days presents with abdominal pain, anorexia, steatorrhea. Steatorrhea gives it to you right away, and watery diarrhea. There's no indication of blood, no blood. خلاص. You see diarrhea, it's one of two. You see blood, it's amoeba histolytica. You don't see blood, then it's yes, Giardia lamblia, right? So D, like Noor and there's no name. 212214455 said. No, it's not E. coli, it's Giardiasis. Giardia lamblia. It has two stages, a trophozoite and a cyst. Trophozoite is pear-shaped with two nuclei, and the suction it attaches to the intestinal tract, right? And it does all of that. And then this is the cyst. This is the trophozoite, and each cyst gives rise to two trophozoites. So if you can tell the difference between the cysts of Entamoeba and Giardia, right? This cyst is very oval. Giardia is very circular, right? And the trophozoite, it kind of looks like a guy. It has eyes, like bags under his eyes, and it looks like a pear, right? So Giardiasis is, inshallah, very easy to identify. Sometimes she'll even give you a picture that this is basically split into two and it's about to become two trophozoites, and you're expected to know that it's going to become two trophozoites and it's one Giardiasis or Giardia lamblia cyst. So the cyst is infective and the cyst and the trophozoites are diagnostic. Here's another picture of the trophozoite and the cysts. Okay, this one's شوية tricky. A wildlife photographer travels to a big game park in East Africa and returns home with intermittent fever and painless canker-like sores on his neck. A Giemsa stained blood smear is positive for a flagellated microbe shown in the image. Which of the following mechanisms gives the microbe the ability to evade humoral defense responses? Hmm. Okay, what's the diagnosis? What is this? Before you answer, what's the diagnosis? It is trypanosoma, yeah. Trypanosoma, but which one? Cruzi or Brucey? Rhodiense, right? It can be Rhodiense, yes, because it's Brucey, it's not Cruzi. Cruzi is different. I think there's a question about Cruzi too, so I won't say anything yet. So the answer here is glycoprotein switching, okay? Um, so this is caused by Trypanosoma brucei rhodiense. The trypomastogote stage is seen here. It's able to hide from host defenses by switching its glycoprotein surface molecules, okay? So this is something it's good to keep in mind. So we have Trypanosoma brucei gambiense and rhodiense. Something really amazing about Trypanosoma is the cutaneous one is cruzi, so C, cutaneous. And the blood one is brucei, so B, blood. Okay? Trypanosoma brucei gambiense causes West African and rhodiense causes East African. Okay? I think Gambia is in West Africa and Rwanda is in East Africa. Anyway, it's the vectors that sit. Oh, I should have asked this here before I came to the slide. The vectors that fly. And the humans are the reservoir for Trypanosoma brucei. It's important to know who's the reservoir. Is it an animal? Is it a human? And it's important to know who the vector is in, obviously. And like I said, the reservoir is very important to know. Okay. Oh yeah, I think it can also live in domestic animals and wild animals. Okay, so the infective stage is the metacyclic trypomastogote, and the diagnostic stage is the trypomastogotes in blood. Okay. So metacyclic trypomastogotes in infective and the trypomastogotes in blood, which is diagnostic. Okay, so these are the trypomastogotes of Trypanosoma brucei. Okay, a middle-aged man who emigrated from South America unexpectedly dies of cardiac failure. When you see anything cardiac and you think it's a parasite infection, you should immediately have something in mind, right? A histological section of the myocardial tissue reveals numerous bodies, as shown in the image. How did the man most likely become infected with this disease? Someone said C, okay. Yeah, okay. Okay, fine. No one else is gonna answer. Yes, it's Trypanosoma cruzi, and it's usually found inside cardiomyocytes, right? What's the vector for it? Oh, it's here anyway. Reduvid bug, also known as the kissing bug, right? Cone-nosed or kissing bug. It's important to know all of its names, by the way. Reduvid, I don't think triatoma is important, but might as well. They asked us about cone nose and they asked us about kissing bug as well. So it's good to know its name. Okay, so the infective stage is, if I can read it, trypomastogotes interbite wound or mucosal membrane, and the diagnostic is the intracellular amastogotes. Okay. Uh, so uh, Trypomastogotes can be found in clinical samples, and in the chronic phase, you can find amastogotes. In acute, you can find trypomastogotes. In chronic, you can find amastogotes. And here is the amastogote inside the cardiomyocyte, and here's the trypomastogote. This is an amastogote inside the cardiomyocyte, which is similar to the one in the picture. Okay, we're almost halfway there. A 26-year-old woman with uncomplicated malaria who was treated initially with chloroquine now has relapsed. What is the reason for a chloroquine-treated case of Plasmodium vivax relapsing? Guys. Okay, what else can relapse? Vivax can relapse, right? What else? Ovale, right? Yes, Vivax and Ovale can relapse. Okay, good. Because they can make hypnotoids in the liver. طيب, so Plasmodium, the female Anopheles mosquito, I should have asked again. I forgot to ask. So there are Vivax, Ovale, Malaria, and Falciparum and Noelsi. Which is the worst of these? The one that's been causing the most problems to everyone. Falciparum, right? Because it's very resistant. It resists antibiotics or drugs easily, right? Yeah, so the sexual cycle is in mosquitoes and the asexual is in humans. The sexual cycle is called sporogony and the asexual is called schizogony. So schizo in Greek or Latin or whatever it is, it means, yes, it attacks RBCs of all ages. What was I saying? Oh yeah, schizo means like breaking or splitting. So like schizophrenia means splitting of the mind, right? And a schizont means it's being split. Like here, this is from a third year slide. It looks better than the life cycles that Dr. Muhabbat put in her slides. Sporozoites are the infective stage. They go to the liver. They make hypnozoites, and they would be dormant or latent if it's Vivax or Ovale. Then they become schizonts, like I said, schizophrenia, splitting of the mind. Then they the what is it called? The liver cells, they split open, and merozoites come out, go to red blood cells. The red blood cells, they split again. They become trophozoites, and the ring stage trophozoites, مثلا, and then they become schizons, and then again merozoites. And the hepatic cells. Okay. So in these are, I think, these are thin, and these are thick. So can someone tell me what's the difference between the thin and thick smears? Thin you can see RBCs, right? Thick you can't. So that means we use thick to tell if this person has a plasmodium infection or not, and we use the thin smear to tell which species of it is it, right? If it's Falciparum, Vivax ovale, Malaria, Noelsi, right? Okay. An untreated AIDS patient, CD41 count of 180 cells, whatever, from Southern California has developed a progressively severe headache and mental confusion, along with ataxia and retinochoroiditis. Focal lesions are present on a computed tomography scan of his brain. No mucocutaneous lesions are found. He has been living under a bridge for the past 2 years. His level of immunoglobulin G to the infectious agent is high, which is the most likely explanation for how his current infection started. Okay, someone said D. I don't know, maybe no, it's not. That's not the right answer. Good thinking. Yeah, C. So it's reactivation of bradyzoids cysts from an earlier infection. So this person has encephalitis. Yeah, so Cryptococcus neoformans, right? Okay. Thinking that there's something wrong. Wait. Okay, this is toxoplasmosis. I'm not really sure why it's C, but I think it's because this is a reinfection. And since he's immunocompromised, it's easy for him to be reinfected. In addition, based on patient symptoms, infection most likely encephalitis or meningitis not present. Yeah, okay. This is toxoplasmosis. Okay, so toxoplasmosis is usually from cats, right? Other felines maybe, but it's usually from domestic cats because those are the ones that are mostly around. Um, Toxoplasma gondii is usually ingestion of cysts in uncooked meat or cysts in cat feces, which I don't know how it can get in your food, but maybe like a bug went on it and then went on your food. Okay, so this is the life cycle of toxoplasmosis. You can see the fecal oocysts, and then the cat's infected or animals such as rodents. The oocysts transform into tachyzoids shortly after ingestion. These tachyzoids localize in the neural and muscle tissue and develop into tissue cysts called bradyzoids. So brady because they multiply slowly, and tachyzoids because they multiply quickly, right? Yeah. Okay. So the cysts, tissue cysts are an important diagnostic feature and a source of organisms when the tissue cysts break in an immunocompromised patient, like the patient that was here. Sorry for the confusion, by the way. Anyway, this is toxoplasmosis. These are tachyzoids, and these are the tissue cysts, which are bradyzoids, like we mentioned here. Okay, do you guys want to take a break and then we'll continue because we have like we still have a lot left. Maybe take a 5-minute break. Okay, can we stop the recording and then I'll come back in 5 minutes?
Yes, sure.
Okay, thank you. Okay, let's continue. Bismillah. A 40-year-old man goes on a camping vacation with his family. One day after swimming in a freshwater lake near the campsite, he develops nausea and vomiting and starts to behave irrationally. His family takes him to the emergency department where food samples are taken and a spinal tap is performed. He is diagnosed with rapidly progressing meningoencephalitis or encephalitis and dies shortly thereafter. Which of the following protozoa was most likely the cause of the man's illness? Yes, Cofonasa. Yeah, it's Naegleria fowleri. Because it causes rapidly progressing meningoencephalitis. Okay, so this is Naegleria fowleri. It has 3 stages: a cyst, trophozoite, and a flagellate. Its infective stage, where is it? So the trophozoite is infective, and the diagnostic stage is the trophozoite and CSF. Okay? Yeah, the only infective stage of the amoeba is a trophozoite. It's written here, and I don't know why I was reading it from here. Anyway, yeah, it causes amoebic meningoencephalitis, or PAM, primary amoebic meningoencephalitis. Okay, a 61-year-old girl complains of abnormal vaginal discharge as well as itching, tenderness, and burning on the vulvulovaginal area. On examination, there is vulvular and vaginal erythema and colpitis muscularis or macularis. Results of a wet mount examination are shown in the image. Which additional symptom would most likely be seen in this patient? Hmm. Hmm. Good thinking, but no. Good thinking, but that's not the right answer. It's okay. Yes, yeah. I was gonna say let's cross out the things that are wrong. Basic, but yeah, profuse frothy vaginal discharge. Discharge. Do you know what this is? Do you know what she has? Yes, she has Trichomonas vaginalis. Go. Hello. Trichomonas vaginalis resides in the female lower genitalia tract, male urethra, prostate, where it can replicate by binary fission. Um, where is its infective stage? Diagnostic stage is trophozoite, and trophozoite in vagina or orifice of the urethra is the infective stage. So basically, trophozoite is both infective and diagnostic. Um, yeah, so it can be prevented by just uh, uh, safe sex and stuff like that. Anyway, a patient who lives on Long Island presents with fever, hemoglobinuria. The lab reports that the CBC is remarkable for a parasite shown in the image here. The patient has not traveled abroad for the past 10 years. Except for an occasional trip to Canada, what's the most likely diagnosis? Yes, okay. So this patient has babesia, right? Babesiosis. Zoonotic infection, opportunistic hosts are humans for babesia when bitten by a nymph or adult tick. So it's important to remember this picture, and these are the species of babesia, Microti divergens, Duncani, and there's one that's called MO1, unnamed strain. I think we got a question about MO1, so maybe keep it in mind, okay? Um, this is the life cycle of Babesia. The infective stage is the sporozoite, and the diagnostic stage is the, where is it? Trophozoite, I guess. Yeah. So sporozoite is infective and is also for Lyme. Yeah, it is, yeah. It's for Lyme disease also, which is by Borrelia burgdorferi, which is the microorganism for Lyme. And it's a targetoid lesion. Okay, you're welcome. So we said infective is sporozoites and the diagnostic is trophozoites. Okay. I know these names are very confusing. Oh, Helminths. Okay. Um. So we have two main types of helminths. We have roundworms and flatworms, right? Platyhelminths, or which sounds like flat, and nemathelminths or roundworms. Then we have intestinal and tissue for the roundworms, and flatworms we have the cystodes, which are segmented, and the unsegmented, which are trematodes. Okay. 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 Give me some examples of these. What are some examples? Okay. What is Ascaris? Yeah. What is Ascaris? What type of it? Yeah. It's a nematode, right? It's a nematode. Okay. What about, for example, Enterobius? What is Enterobius? Or Vermicularis? What type of worm is it? It's the same as Trichoris, Trichoria, and filarial worms. It's a nematode, right? Okay, what about cystodes? What are some examples of cystodes? Yes, Tinea saginata, Solium, Echinococcus granulosus, right? Yeah. Yeah. The bottom something Latin, right? Inshallah. That's not important though. Okay, what are some examples of trematodes? Schistosome, right? Yeah, what are the three species of schistosome? Hematobium, right? Which looks like a pin. Japonicum, which looks like a Japanese flag, it's just circular. And one more. Mansonia, okay. So, someone already said it, yeah. Okay, good. Bismillah. A biology graduate student who recently visited a tropical region of Africa presents with new visual impairment and the sensation that something is moving in her eye. Onchocerca volvulus, right? You see something in the eye, it's most likely Onchocerca volvulus in POD, right? Okay. She tells you she's concerned because she's been warned about her eye being transmitted by black flies. When in Africa, she was in a river area. Despite her best efforts, she received a lot of black fly bites. She also has some subcutaneous nodules, and if her infection was acquired by black fly, was most likely causative agent. Onchocerca volvulus. This is the life cycle of Onchocerca volvulus. Its diagnostic stage is the microfilaria. I don't know how you pronounce it. And the infective stage, if I can find it. I think it was the filariform larva. I'm not sure though. I can't find it here. Can someone confirm? Yeah, okay, here. It's the black flies. Yeah, L3 larva enter the bite wound. And the diagnostic is, like I said, the microfilaria, or however you pronounce it. And vector is the black fly. Okay, so this is Onchocerca volvulus. I think this is really cool to the point where I have a WhatsApp sticker of this. I don't know. I just really like how it looks. The infective is the L3 larva. Diagnostic is the microfilarial worms, which are here. Yeah, microfilaria. Okay. Yeah. So it's vector borne, right? And like we said, they use a scrape or a skin snip scrape biopsy. You, it's cool. Wallah. Imagine like a worm in your eye. Anyway, so yeah, these are also onchocerciasis. This exact picture was in our OSPE. She's like, oh, which organism would you do this test for? And it's Onchocerca volvulus. Okay. A woman who imports food from Mexico spends several months per year in rural Mexico who had to have a compound leg fracture pinned and set in Mexico and has returned 3 days later. She now has signs of acute appendicitis and is taken to surgery in Houston. When her appendix is removed, it is found to contain a light-colored 20.5 centimeter long roundworm as well as bile-stained knobby eggs consisted of the ascaris. How did she acquire this infection? Yeah, so this is simple, right? This is ascaris, so she ingested food with contaminated eggs, right? Yeah, okay. The life cycle of ascaris. This is one of those where you can cough it up and swallow it again, right? So the infective egg are swallowed, eggs reach the small intestine and hatch. The larvae migrate into the hepatic portal uh, through the intestinal wall. Larvae enter the lungs and alveolar spaces, causing cough. Right? Coughed up larvae are swallowed. Larvae reach the small intestine for a second time, mature, and adult worms lay eggs. Eggs pass in the feces, and the cycle continues. So it grows in the intestine, then it goes into the lungs, and you cough them up and you swallow them again after they hatch, or they hatch in the the coughed up larvae are swallowed, so they're already hatched. You swallow the hatched larva. So this is Ascaris. It's the largest roundworm. This is very important for you to remember. The largest roundworm is Ascaris lubricoides. The definitive host is humans, and there is no intermediate host. Infective is embryonated eggs, and the diagnostic is eggs, occasionally adult or larval worm, and you can just see it. It's huge, and it's fecal oral. This is another other pictures of Ascaris. This is a fertilized egg. This is egg containing larva, which will be infective if ingested. Like we said, the embryonated eggs are the infective stage. Okay. A child with a Helminth parasite is found to be anemic. You see anemic, خلاص على طول you should know the answer. Which parasitic worm is linked to microcytic anemia in children? 819, okay. Yeah, this is a hookworm. Hookworm infection, right? You see anemia, you immediately think hookworm. Yeah. So this is the hookworm. The eggs and the feces are the diagnostic stage, and the filariform larva, which you step on, are the infective stage, or not you step on, someone steps on it, whoever is infected with it. The released rhabditiform larvae grow in the feces and or the soil. After 5 to 10 days, and I don't know what's 2 months, they become filariform, third stage larvae that are infective. Hello, and then someone steps, it hooks onto their foot. That's why it's called the hookworm, and then it causes anemia, whatever, and we diagnose it. A hookworm or Encyclostoma duodenale and Nicator americanus. Infective, like we said, filariform larva, and diagnostic eggs demonstrated in stool samples. Its mode of transmission, like we said, skin penetration. Okay, I don't have to tell you how important this is and how important it is that you know the names Encyclostoma and Nicator americanus. We're almost done, guys, okay? So just bear with me. A 9-year-old child is observed repeatedly scratching herself around the anal canal. So you know على طول, right? A distinctive microscopic eggs are detected via the cellophane tape technique, Scotch tape test. Sorry, they like to be fancy. What is the correct diagnosis? Yes, it's Enterobiasis, Enterobius vermicularis. This is my favorite helminth or parasite because it's funny. Okay, it's also called the butt scratch bug. Anyway, this is the embryonated eggs which are infective, and the diagnostic is the eggs on the perianal folds. So like at night, the worm comes out and lays its eggs on the area around the anal canal, or the anal opening, whatever. And then the child would wake up and it'd scratch their behind, leaving fomites, I believe. It doesn't say anything. I think it's fomites. I'll trust myself on the blanket and the bed sheets and whatever. And then مثلا the mother will go and uh, what is it called? Try to fix the bed and stuff, and the fomites will go all up in the air, and someone would inhale it, and then they get infected again. Infective stage, the embryonated eggs, and eggs demonstrated on a Scotch tape preparation is the diagnostic. Fomites, yeah, fomites, mode of transmission, ingestion, fecal oral, fomites by inhalation. Okay, and it's really important you know about the fomites. Okay, Enterobius vermicularis again, the Scotch tape test. This is a picture of you know what, and you can see the worms. Scotch tape preparation, observation of adult worms on the perianal skin. And this picture is extremely important to know, okay? This is very, 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 very likely to come in your OSPI. This is a picture of the Enterobius vermicularis egg, okay? Yeah, curved side, flat side, easy to remember. How is schistosoma hematobium transmitted? Simple. Yes, yes, Nasser, good. Okay, great. So standing or swimming in contaminated water. Simply, you just stand there, or someone stands there and they get the infection. All schistosomas are transmitted by skin penetration from standing or swimming in contaminated water. Snails are an intermediate host. Okay, so this is, I believe this is Mansoni, this is hematobium, and this is Japonicum, if I'm not mistaken. Yeah, I think it's the same order, Mansoni, Japonicum, hematobium. So the way I like to remember is hematobium would be good for taking a blood sample. Obviously, yani, it's just to remember because it looks like a straight needle that won't be difficult to use. Mansoni sounds like an Italian name, and this looks like an Italian guy with like a toothpick or a cigarette in his mouth. And the Japanese flag is just a red circle, so it's completely circular, like Japonicum. Okay, so hopefully that helps. The infective stage is the Cercaria, and the diagnostic stage is the just the eggs in stool feces. You're welcome. So it's that free swimming Cercaria penetrate the skin. Yeah, okay, it's here. I don't know why I keep trying to read it from here. Anyway, The adult worms lay eggs which appear in the stool. Mansoni japonicum are in the urine for hematobium. And something else that like to remember, a lot of the time when you read questions, they tell you, oh, the patient has hematuria or what is it called? Hemoglobinuria, right? So usually blood would be more prominent in urine. So hematobium, which is used for blood, will be very clear in urine, right? Mansoni japonicum, just the other side, right? Okay, you see this. What is this? Don't read the question. What is this? Barrel shaped. Trichoris trichoria, right? Okay, now let's read the question. A child is taken to the doctor because of a 2-week bout of abdominal discomfort and diarrheic stools. A fecal concentration reveals scores of bipolar eggs like the one shown, indicating a heavy parasite burden. Which of the following complications might occur if the child is not treated for this parasite? Yeah, whipworm. Yeah. Yes. Yeah. Prolapse of the rectum. It's weird, right? Okay. Um, yeah, so this is the embryonated eggs, which are infective, and these are the unembryonated eggs, which are diagnostic. That's it. This is Trichoria. Definitive host is humans, no intermediate host. Large intestine, embryonated eggs infective. Diagnostic eggs are adult worms, and the unembryonated eggs, to be more specific. And it's in a fecal oral ingestion mode of transmission. This is Trichoria. Like we said, double barrel shaped. Um, very important. This picture is also very likely to come in your OSPE. Um, and these are the adult worms found in the gastrointestinal mucosa. We're almost done. Almost done. Okay. Which of the following modes of transmission accounts for the development of neurocysticercosis in humans? So, what microorganism causes neurocysticercosis? Tinea what? I don't think it's agenata. I believe it's solium. Yeah, the one from pigs, right? Yeah, from pork. Yeah. So Teniid eggs, right? Fecal oral teniid eggs from Taenia solium. What is the explanation for Taenia? Oh, okay. So there's another question about Taenia. Forgot to put this question. Yeah, so clear as day, right? From undercooked pork, Taenia solium. Okay, here's Taenia solium. The infective stage is the embryonated eggs, and the diagnostic stage is the eggs or the gravid proglottids in feces, right? It's yeah, cause both intestinal and extra-intestinal diseases. This is Taenia solium. It has these rostellum or hooklets. Saginata doesn't have them. Okay, and it has these things, right? It's very important to differentiate between solium and saginata, especially in this thing. I forgot what this is, but I remember that this was really important, and there was a difference between solium and saginata. I think one is like branched and one is not branched, or something like that, on the inside of the actual uterine branches. Yes. Okay. Thank you. Yeah. Uterine branches. Okay. Yeah. You're absolutely right. Okay. And solium 7 to 12 for solium. Yeah. Okay. Less than saginata. Saginata has more. Okay. 15 to 30 for saginata. Okay. Amazing. You guys are amazing. Great. Kufu. Okay, hello. Yeah, it says here, proglottids are 7 to 12 uterine branches. Hooklets? I thought these were the hooklets. Correct me if I'm wrong. These are the hooklets. Okay. Yeah, this is the adult worm with the head with rosellum hooklets, right? Rosellum hooklets. Yeah, it says here adult worm. Okay, okay. No problem. And 2 pairs of suckers. Yeah. Okay. So 4. Okay, the definitive host is humans, which will cause teniasis. Intermediate host is pigs, also teniasis. Accidental cysticercosis, right? Or neurocysticercosis. Infective stage, we said, is the larva. And eggs and diagnostic is the eggs, proglatids, adult worms. And these are the proglatids, right? We said the uterine branches. Okay, moving on. A woman who immigrated from Asia undergoes spontaneous abortion in the recovery room. She passes numerous proglatids. The medical technologist injects one of the proglatids with India ink to delineate, I don't know what this word is, the uterus. How did she become infected with this tapeworm? Yeah, B. Okay. So the one we talked about before was solium. This one's saginata, right? Which is from beef. Sirloin is a cut of steak. Yeah. Okay. So this is Tinea saginata. Look how different it looks. It looks lifeless. That one looks full of life. Oh, I guess they have the same eggs. Yeah. So this one looks like a tower. Solium. Saginata looks like nothing, and this one has way more uterine branches, 15 to 30. Head without hooklets, the adult worm. And the solium has hooklets. Saginata doesn't. Okay. Tini saginata, definitive host is the human, intermediate cattle, herbivores, livestock, so beef, sheep, whatever. Infective stage is the larva, cysticerci, and the agnostic stage is eggs, proglatids, adult worm. Ingestion of larva, raw, undercooked beef. Saginata usually doesn't cause neurocysticercosis. I don't think it does. What I remember is that solium is the one that causes neurocysticercosis. Saginata doesn't. Okay, but please make sure of that. Okay, so cysticerci is the infective, and the diagnostic is the adult worms, or the, what is it called? The proglatids, eggs. Okay, which of the following protozoans is free living and acquisition does not generally indicate fecal contamination? You can just, someone can just get it because no reason. Yeah, acanthamoeba, right? Acanthamoebiasis. Okay. Acanthamoeba keratitis or granulomatous amoebic encephalitis, or a disseminated infection. So these two are in immunocompromised patients, and this one is in a normal patient or healthy person. So acanthamoeba keratitis can just happen to anyone. Granulomatous amoebic encephalitis is a compromised immune system, disseminated infection, also immunocompromised patients. Colbertsoni is a common cause of human infections. So the one that we are uh, caring for is acanthamoeba colbertsoni. Okay, so and it's important to know which one is for the immunocompromised, which one's for not. Acanthamoeba, healthy, keratitis, healthy, GAE, compromised, immunocompromised, and disseminated for immunocompromised. I think we already talked about this. I think this is the last question. Either this or one more. You see dogs, you answer straight away, right? Yeah. Several dogs that work Native American sheep ranches in community of New Mexico undergo their yearly purges for intestinal worms. Examination reveals that all the stools are positive for tapeworms, including tiny tapeworm species that measures like 10 millimeters or something, which medically important diseases linked to this tapeworm. And you guys said Echinococcus, yes. So Echinococcus granulosus. What's another name for Echinococcus granulosus? Or the name of the disease? So I should have been more clear. The disease, not the microorganism. So it can be a cyst that's found in the liver. Yeah, hydatid disease. Yeah. I think we had a PBL about it. Did you guys have one? We had one about Echinococcus. No? They changed the PBLs. Okay. Yeah, so this is Echinococcus. The embryonated egg is the infective, and the hydatid cyst is the diagnostic. It's usually found in the liver. That's probably what you're going to get in the exam. Inshallah, should be easy. You'll just see a cyst in the liver, Echinococcus granulosus straight away. Canines are the definitive host. Intermediate hosts are herbivores, humans, accidental, and dead end. So they are accidental and they most likely don't transmit disease to someone else. Diagnostic hydatid cysts in the liver, infective, the larva, and the definitive host, and eggs in the intermediate host. So ingestion of the eggs by intermediate host or unilocular hydatid cyst disease, multilocular hydatid disease is caused by E. Echinococcus multilocularis. Granulosis caused unilocular. And this is another thing you should know about Echinococcus. This is a picture you can remember. Hydatid brood capsules with prostoscolis, scolices, or however you pronounce it. And that's it. We did it. 160 slides. Do you guys have any question? Please scan this QR code and give us some feedback. Does anyone have any questions? Please let me know. This is my number. You can message me anytime, ask me questions. Habibi Allah. You're welcome. You're welcome.